Hello everyone. I am presenting this information for educational purposes and to advocate for the profession of occupational therapy. My name is Emily Altman and I am an occupational therapy student at the University of Findlay in their OTD program. I received my Bachelor's of Science in Exercise Science from the University of Toledo. This presentation will be helpful for individuals wanting to seek occupational therapy services and for individuals that are interested in the profession of occupational therapy. With that being said, there are some objectives that I would like to cover with this presentation. What is occupational therapy? Who are occupational therapy practitioners? When and why does someone need occupational therapy? Where can I get occupational therapy? Who could benefit from occupational therapy services? How do I schedule an occupational therapy visit? How do I become an occupational therapist? What exactly is occupational therapy? In order to understand what occupational therapy is, we need to first define the term of occupation. According to the Occupational Therapy Practice Framework, Domain and Process 4th edition, occupations are the everyday activities that people do as individuals, in families, and with communities to occupy time and bring meaning and purpose to life. There are many different categories of occupations listed in the Occupational Therapy Practice Framework. The first category are activities of daily living, also known as ADLs. These are activities of taking care of one's own body. This could include bathing and showering, toileting, and many more. The second category is instrumental activities of daily living, also known as IADLs. These are activities that allow you to support your daily life within your home and the community. This may include taking care of your children or taking care of your pets. The third category of occupations is health management, an activity that enables you to develop, manage, and maintain your health and wellness routines to improve or maintain health by supporting participation in other occupations. Rest and sleep. These are activities related to rest and sleep to support healthy, active engagement in occupations. This includes both the process of resting and sleeping and the routines an individual may go through to prepare themselves to sleep. This includes putting pajamas on, brushing their teeth before bed, and dimming the lights. Education. These are activities involving learning and participating in the educational environment. This includes both formal and informal education. Work. Activities involving labor related to the development, production, delivery, or management of objects or services. This may or may not benefit the individual financially. This includes employment interest, employment seeking, job performance, a person's retirement, or volunteering. Play. These are activities that motivate, internally control, and are chosen freely. This allows the individual to escape reality. We generally think of the occupation of play being applied to children. Leisure. These are activities that are non-obligatory and motivate an individual. We consider this the adult form of play. Social participation. These are activities that involve social interaction with others, including family, friends, peers, and community members, supporting social independence. Overall, occupations are meaningful everyday activities. Depending on the individual's roles will determine what occupations they may find meaningful. For example, a child's main occupations may include play and learning to develop important skills, whereas an adult may engage with family and friends while trying to manage their home. Valued occupations can be disrupted from an accident or some form of injury. Occupational therapists incorporate valued occupations into the rehabilitation process in order to make the therapy process more client-centered to the individual. Who exactly are occupational therapy practitioners? They may be an occupational therapist or an occupational therapy assistant. Occupational therapy assistants are supervised by an occupational therapist. Occupational therapy practitioners use research and evidence-based practice for client-centered and effective interventions. They use an holistic perspective to evaluate the client's psychological, physical, emotional, and social makeup and how it affects their body and their mind. When and why does someone need occupational therapy? This can include anyone diagnosed with a new health condition inhibiting the participation in occupational tasks that are meaningful and important to the individual. Some examples include a child with autism may be having trouble succeeding in school. An adult that is aging and is wanting to stay at home, but there are several safety issues that need to be addressed. This may include an adult that may have an increased fall risk, and an occupational therapist would work with them to incorporate safety precautions within their home, such as picking up or moving rugs that may become a tripping hazard for them. Also, a person experiencing depression, having difficulty with everyday activities. Occupational therapy services help individuals with achieving goals, staying healthy and productive, maintaining or rebuilding independence by the use of assistive devices. This may include a communication board for an individual that is having difficulty communicating with people, or it may also include various different adaptive equipment that an individual that had recently had a stroke may use to shower. They may also help with participation in everyday activities that are important to an individual, and they also help so that they can live life to its fullest regardless of health condition, disability, or risk factors. Where can I get occupational therapy? There are several different settings that occupational therapy services are offered in. A few include hospitals, schools, clinics, skilled nursing facilities, community centers, healthcare facilities, in the individual's own home, or in a jail setting. Who could benefit from occupational therapy services? This could include individuals with amputations, depression and anxiety, arthritis, brain injury, dementia and Alzheimer's, carpal tunnel syndrome, hip and knee replacements, spinal injury, or strokes. Those items that were listed on the left side are the main diagnosis of adults. And then on the right side are some diagnoses common in children, which include ADHD, autism, cerebral palsy, Down syndrome, developmental delays, learning difficulties, sensory processing disorders, and spinal bifida. Overall, any individual that has a deficit in occupational participation may receive occupational therapy services. How do I schedule an occupational therapy visit? Well, first, you may be referred from your physician if your physician believes that you could benefit from occupational therapy services. Personally, you may look for occupational therapy services that are offered throughout your community. If this is involving your child, you may talk to your child's teacher about occupational therapy services that are offered through your child's school. And anyone can be referred to occupational therapy services. Some of you watching this presentation may be wanting to become an occupational therapist. So how exactly do I become an occupational therapist? Well, you can obtain a bachelor's degree in any major. You just need to make sure that you meet the prerequisites of the desired program you are wanting to be accepted into. Some common majors include psychology, exercise science, intervention specialist, or social work. Programs are still offering a master's or a doctoral program. With that being said, you will want to keep in mind that entry-level degree requirements will be switching over to a doctoral level by July 1st of 2027. You can apply through OTCAS, which is the Occupational Therapy Centralized Application Service. There are several schools that have additional requirements besides filling out the OTCAS application, so you're going to want to make sure you are checking their websites to know all the requirements to be able to be accepted into their program. Also, many programs require observation hours that you will want to make sure you know how many hours are needed for your desired program. As stated at the beginning of this presentation, I am an OTD student at the University of Findlay. With that being said, I would like to take some time to go through the University of Findlay's OTD program's specific requirements. They are accepting applications July through October. You will be notified of acceptance mid to late December. This is a 3-year program that starts in early June. Some admission requirements include you must complete prerequisites with a C or better. You must have a minimum overall GPA of 3.0 on a 4.0 scale. You must obtain 50 hours of observation in 2 different settings with a minimum of 20 hours in each setting. You must successfully complete a bachelor's degree from an accredited institution. You must complete the OTCAS and supplemental application materials. And you also must provide 3 satisfactory professional recommendations. The Occupational Therapy Department at the University of Findlay selects applicants through various different criteria. This includes the individual's GPA, their program preparation, their involvement in outside activities, the service activities they are involved in, the individual's understanding of the profession, the recommendations that were provided on the OTCAS application, the written and verbal skills of the individual that will be assessed through the interviews, their leadership ability, and also the University of Findlay's Occupational Therapy Department gives special consideration to individuals that completed their undergraduate degree at the University of Findlay. For those of you interested in applying to occupational therapy programs, I can provide you with some personal tips that can guide you through the application process. First, you're going to want to be aware of application due dates and prerequisites for the programs you're interested in applying for. Every program has different due dates and different prerequisites that are required for you to be accepted into their program. I encourage you to make regular appointments with your undergraduate advisor to ensure you are meeting all the prerequisites needed for the programs you're wanting to apply for. Second, start the application process on the first day the application is available. The OTCAS application can be very time-consuming, and also several programs require you to fill out supplemental applications that are also very time-consuming. I also encourage you to visit universities that you're interested in. You can gain a great deal of knowledge of what they have to offer you by doing a simple visit to their university. For example, the University of Findlay offers a Pursuit OT night that I personally attended when I was interested in attending their program. This night provided me with tips and tricks on the application process, and also I was able to have several of my questions answered about their program and how to fill out specific parts of their application. I was also able to meet several faculty members throughout their program. This wraps up my presentation. I would like to encourage you all to contact me at the email on this slide with any questions or clarifications you would like involving this presentation. You can also visit www.aota.org for more information about occupational therapy. I would like to thank you all for listening to me present this information. Thank you.